In this video, we will introduce you to and show you how to use the SPH medical air transfer system. The air transfer system enables all-day patient care and is the core of every safe patient handling program. It can be used for repositioning and turning patients in bed in addition to lateral transfers. The SPH medical air transfer system has been specifically designed to reduce the risks of caregiver injury while improving the patient's comfort and satisfaction. The air transfer system is available with reusable or single patient use transfer mats, both of which work in the same way. Be sure to follow these best practice tips to maximize safety. Use the hands-on approach. The hands-on approach means that one caregiver is always in contact with the inflated or deflated air transfer mat, with their hands on the handles and their body against the transfer mat. This hands-on approach is a safety position that ensures the caregiver is always in control of the air transfer mat. 2. Use the angled transfer method. The SPH medical air transfer system includes two key components, the air transfer mattress and the air supply unit. A simple on-off switch activates the air supply unit and sends air through the hose to inflate the transfer mattress. The underside of the transfer mattress features hundreds of perforations that allow air to escape, much like an air hockey table. This creates a thin layer of air between the transfer pad and the surface of the bed or gurney. As a result, friction is greatly reduced and allows your patient to glide across the surface on a cushion of air. The SPH medical air transfer mattress is designed to help center and cradle the patient on the mat for comfort and support. On the top side of the transfer mattress, there are two safety straps, much like seat belts, for added patient stability and security. The reinforced handles of the SPH medical air transfer mattress enable caregivers to maintain proper body mechanics with a safe, upright posture during repositioning or patient transfer. Remember to use the hands-on approach by keeping your hands on the handles and your body in contact with the air transfer mat. When transferring to a bed or stretcher, a raised side rail adds extra security to ensure that the patient does not slide beyond the transfer surface. The air supply unit can be conveniently hung from the foot end of the patient's bed for easy transport. You can also use the mobile transport stand available as an accessory. In high-use areas, hospital beds and stretchers can be pre-made with an air transfer mat by housekeeping staff to ensure it is readily available. Fresh bed linens and an absorbent pad can be placed on top of the air transfer mat to keep it clean. Be sure to tuck safety straps out of the way, but ensure that they are still visible and easy to access. If the patient is already in bed, you can place the air transfer mat under the patient by using your standard linen changing procedure or log rolling technique. Always center your patient on the mat with their feet positioned towards the end with the label marked foot end. The patient's head should be 1 to 3 inches below the top of the mattress. After the patient is centered on the mat, connect the two safety belts across the patient. Leave them slightly loose to allow them to tighten as the mat inflates. Before transferring, check that all brakes on both transfer surfaces are fully engaged and that the destination surface is 1 to 2 inches lower than the starting surface. Ensure that the air supply is plugged into a standard AC outlet and that the free end of the flexible air supply hose is connected to the air transfer mattress by inserting it into the small air port on either side of the foot end of the mattress. To achieve proper inflation of the mattress, snap the hose onto the transfer mattress, then secure the sleeve snugly around the hose. Next, press the power button to turn on the air supply. A green indicator light will illuminate to tell you that the air supply is operational. The transfer pad will inflate with low air pressure and gently lift the patient. To perform the transfer, simply pull the handles on the foot end first so that it leads the torso section by 16 to 24 inches, then follow with the torso section. A second caregiver can push the foot end first from the opposite side in coordination with the person pulling. Always remember to use the hands-on approach. Once you have completed the transfer or repositioning of the patient, ensure that at least one caregiver is using the hands-on approach with hands and body in contact with the air transfer mattress. Validate that the patient is centered on the destination surface, then turn off the air supply to deflate the mattress and raise the side rails. The air supply should remain off until the next repositioning or transfer. If the patient is being transported, You can wrap the power cord up and connect it to the air supply using the black strap on the top of the air supply. Note that the patient can remain on the breathable air transfer mattress for nearly all medical procedures. Every SPH medical air transfer mattress features a helpful guide with pictographic images on the tag located at the foot end of the mattress to guide you through each of the steps we have covered in today's tutorial. Prior to using any SPH medical device, please be sure to read all instruction manuals and always use safe patient handling techniques. Contact SPH Medical for more information about the air transfer system, single patient use mats, and more safe patient handling solutions. Thank you.